Right, good afternoon everybody. Those that are thinking of joining, don't be shy, come and sit down because we've got a cracking sort of half hour, 35 minutes session here. There's no point in me rambling on. These two men are the experts, so I'm going to quickly introduce them. The topic, in case you can't read, is the health inequality gap in construction, our industry, and how we're going to close it. As I say, two brilliant guests that are going to go through this. So, Richard Harrell is the founder of We Build the Future, and his colleague is Andy von Bradsky. I hope I pronounced your name right, Andy. Another Andy, so he's obviously a good man. Now, Andy is, well, what a CV. Very quickly, architect and consultant with over 3 decades experience in design and delivering of housing, advises government, God bless his soul. Do they actually listen? Oh, he works for them. There we go. Chairman of the Housing Forum, a cross-housing industry membership organisation, is also one of the London Mayor's design advocates. He's a member of SGI, a socially engaged Buddhist lay organisation, so a man of a lot of experience. Can't wait to hear him talk. And colleague Richard, he's also an architect with experience working for local authorities, private practice and in central government. Currently the technical director for the Chartered Association of Building Engineers. Following the death of his father from bladder cancer in 2016, he founded this brilliant charity, We Build the Future, with one simple aim of finding ways to help people succeed in their own battles with cancer. So without any more mucking about, straight over to these two great guys.
Thanks very much. It's fantastic to be here, and I hope that you find this both informative and useful. You may not have heard us as a charity before. We're a young charity. We have 3 main aims: to raise money to accelerate improvements in cancer survival, so bettering the science of how we deal with cancer in our industry, helping develop support and advice services and ways to help people negotiate what can be extremely difficult times, and promoting health and well-being to help reduce the incidence of cancer and improve health outcomes for people in the construction industry. We're entirely run by trustees from within the construction industry and the health sector now, and we are focused on improving a situation where there's a lot of potential for things to get better. Why do we know this matters? Well, as I just explained, I set this charity up after my father died of bladder cancer in 2016. That really brought home to me the impact that cancer has on people's lives and also of the people around them, and I wanted to do something to help better the lives of other people and support them through that process. When I started to look at our sector, what I found suggested that this was where we should be working to make things better. So let's talk about the nature of the problem and why more needs to be done. So fundamentally, 1 in 2 people in the UK born after 1960 will develop cancer at some stage in their lives. And my experience was that doesn't just impact the individual, it doesn't just impact their health, it doesn't just impact their dignity, it impacts everyone around them. So if we're not dealing with this directly, the chances are there's someone in our immediate environment who needs a bit more support to deal with cancer. Cancer's now the biggest killer amongst men, having overtaken heart disease, and breast cancer is the biggest killer in women aged 24 to 49. What are we doing to help people when these events happen? Not enough is the simple answer. So we think around 12,000 people a year in our sector will be diagnosed with cancer, and we think that means that cumulatively there are probably in the region of 150,000 people in the built environment sector, so that includes consultancy, construction, product manufacturing, in the built environment as a sector as a whole, who are either dealing with cancer or have had cancer at some stage and are in remission. There's a lot of good news. Cancer survival rates are improving, and for some forms of cancer the survival rates are very high, so for testicular cancer it's 98%, but for other forms the survival rates are still low. Those survival rates have doubled in the last 50 years, and our aim is to help support further improvements in line with Cancer Research UK's aim to improve survival rates to 75% by 2040. Critically, 4 out of 10 cases of cancer are preventable. And more than half of that improvement in cancer survival and the reduction in incident of cancer is going to come through lifestyle changes and helping to avoid the drivers of cancer at the same time. Perhaps critical in the construction sector, prevalence of smoking is still twice that of the national average at nearly 30%. And we have a very high incidence of occupationally related cancers and a long history, unfortunately, of cancer that stems from the nature of work people do. So 56% of all occupational cancer registrations in men are attributable to work in our industry. That means that there are a huge number of people every day who are starting to have to face up to these issues and need our support. Quite simply, they need help, advice, and an environment that makes it as easy as possible for them to get through that process. It's estimated that there were 1.9 million workdays lost to cancer-related ill health in 2014-15, which would cost around £500 million a year. Key to everything we want to do is improving early diagnosis, and the projects we talk about later will be very much linked to that process of getting people to seek help and to get the diagnosis at the right time. And early diagnosis can have a really big impact on how well people get through cancer. So 90% of bowel cancer patients survive if diagnosed at the earliest stage, but only 10% unfortunately will do so at the late stage. And we know that the demographic in our sector makes it much, much harder for people to get that support. So 92% of construction firms have 7 or fewer staff. 42% of construction workers are self-employed. It's a sector that's predominantly male, around 87% male and 80% in the built environment as a whole. And men, forming the majority of that sector, are really poor at seeking health advice and really, really poor at looking to get care. Clearly, if we want early diagnosis, that has to change. Mental health is a leading indicator of the problems that we have in our sector. There are clear indicators that people in construction have poorer health outcomes. This is from the CIOB mental health survey that was published, I think, earlier this year. And the findings here are really, really shocking, and they are many times worse than are found in other sectors. And the one that always shocks me is that 26% of people surveyed through that process had suicidal thoughts in the previous 12 months. I mean, it's a remarkable problem. But it also indicates that there are other health issues that we need to address. If you look at the key factors that are known to drive mental health problems, limited term contracts, long hours, lengthy commutes, time away from the family, pressure to complete work, macho culture that exists within the industry, late payments on work, and uncertainty, we find that many of those are also likely to drive health inequalities. So this is about people being able to access healthcare, having support to access healthcare, and being encouraged to get access to the advice and support they need at the right time. In particular, site workers and people who are disassociated from their home for periods of time during the week, so working away on sites or having difficult commuting hours, find it difficult to get access to that initial advice, and it's a major barrier to them addressing chronic health conditions. And there's an economic case here that we can't forget. So there's a big focus on reducing time lost due to occupational health and safety issues, and that's absolutely right. But that only accounts for around a third of the working days lost to industry. That means that the other 2/3 of working days that are lost due to all types of ill health are, at the moment, have no focus. There's no interest in those matters whatsoever, it seems to me. And I think we've got to change that, because the cost to the industry of that ill health is £4 or £5 billion a year. So there's a really primary business case for industry to get involved. How are we going to address this? Well, as I said, we want to raise funds for cancer research. Science is really important in this space, and we can drive funding for research projects and development of a better knowledge base as to the problems in our industry. We will work to develop support and advice, working with organisations such as Cancer Research UK, who we partner with, to help businesses and individuals find their way through what can be a maze to get the best outcomes. And we want to work with employers and industry bodies and industry leaders to make sure that this is all completely normalised and that the information routes that are required are available to people. And we want to really help promote cancer prevention through health and well-being. We need to improve the environment in our industry. We need to make sure that people are able to stay healthy. Our workforce is absolutely critical to everything we do, and we need to do a lot more to take care of them. That's through supporting them to have better access to better diets, through campaigns to address risks that are inherent to our industry, such as skin cancer, and also promoting better cancer awareness and detection. We've developed a 3-year strategy, our Be Well strategy, which is based around collaboration, campaigning and communication. At the moment, a lot of what we can do is about knitting together information and services that are already available. There are 3 projects within that we're going to talk about a bit more today. Project Open Door, which is about accessing primary healthcare. Our Summit project, which is about collaboration and sun-safe campaigning to reduce the risk of skin cancer. We want to take these practical steps to ensure that information's available and to develop the evidence on how to deliver real change. So we need to get better information. We need to work more closely with a range of industry partners in developing practical solutions. The Summit project is aimed at developing an effective health and well-being network across the building sector as a whole. I think it's very interesting that the summit that was proposed for Construction Week that we originally proposed to attend has proven perhaps a little bit difficult to pull together as a cohesive event. There are lots of initiatives across the sector that are happening. They are not joined up into a strategy for health and well-being once you step beyond site health and safety and occupational health and safety. We think that needs to change, and we're going to work over the next 3 years to bring people together to collaborate more effectively. We are looking for a partner to help us develop our sun-safe products to go onto sites to make construction workers aware of when UV risk is high and to take measures to prevent and reduce the risk of skin cancer. There's peer-reviewed studies suggest somewhere in the region of 20 to 25 construction workers a year die from skin cancer, and when you consider that site health and safety risks result in around 35 or 40 construction deaths a year, that's actually a very significant risk that we need to control better. And our primary area of work at the moment is what we call Project Open Door, which is an initiative to remove barriers to people in the construction sector accessing healthcare. We want to address a poor industry culture in encouraging people to get the health advice they need and to seek treatment, and we want to improve that early diagnosis. I'm going to hand over to my colleague Andy Mombradsky, who's going to talk a bit more about that specific project.
Good afternoon, everybody. I hope you can hear me. It's a bit of a unique experience, this, with a limited audience, but, you know, a really important aspect of our industry is about its health and well-being. So I don't anticipate that anybody listening to this will disagree with our objectives. I am a fellow trustee of the charity, a former colleague of Richard's, and we're a collection of people who have come out of quite influential positions in government and in building agencies to really collaborate around some of these issues. And I'm delighted to be able to talk to you about the work that we've been doing. Richard's given you a bit of an understanding of the issues that we're trying to face at the moment and the way in which we're going about it. I'm going to just go through in a little bit more detail some of the work that we've been doing and some of the issues that we've been addressing. So one of the main issues for us is about culture change. So we want to change the culture of the construction industry and the built environment industry in a way that makes health and healthy living, healthy working, an integral part of it. My interest is very much in preventative health aspects as opposed to curative. So how do we change our lifestyles? How do we make health and well-being an integral part and a culture of our industry? It's about breaking down barriers and making people feel much more aware of the importance of health and being able to talk freely about it and have an engagement in it, which is barrier-free. Very much thanks to Dr. Polly Wotton, who's also a fellow trustee, who's been doing some really pioneering work for us on walk-in clinics. And that initiative, which took place before the lockdown and therefore was much more sort of free and open in terms of talking about these issues before the pandemic. This was an initiative that actually made medical advice available to construction workers in a pilot at King's Cross, and Argent were the developers who made time for this particular pilot to happen. So it's about making medical advice much more readily available to people who are actually in construction and working on sites. Some really interesting statistics came out of that with some very hard work, great collaboration from main contractors who are working on the King's Cross project. They all subscribed to this and allowed the free time for construction workers to come along. There were 16 clinics, 92 people actually volunteered and came forward to actually look at some of the issues of their own health and well-being. Some interesting statistics came out of that. A lot of workers, of course, come from different parts of the country. They work in remotely from where they might be registered. So about 3/4 were actually registered at home, but might have had health issues in the place of their work. So quite a number of them just walked in and became connected with the GP that was local to their construction site. A small number were not registered at all. There was some language difficulties, some real challenges in terms of understanding what the NHS system is and how to navigate it. And some were not registered at all and were able to be registered locally to where the construction site was. The problems that they came forward with, most of them just wanted a health check. There might have been concerns about their health. There might have been worries about what their condition was. Typically, construction workers are muscular, skeletal, those sort of issues to do with tendons and backaches, spinal problems and so forth. So a real number there. But also skin issues, people who are working out on sites in sunlight exposed to skin problems. No chronic issues as such, but real preventative and curative approaches to everyday problems that they might have on a construction site. So some key learnings that Polly came up with in terms of this. Real difficulties for construction workers to make appointments. Working away from home creates its own sort of timetable and its own issues. Real problems in terms of poor understanding of navigating the system. A culture where actually working intensely on a site is much more important. So a sense of people wasting time. So does the contractor, does the main contractor, does the subcontractor actually allow enough time for workers to take time out to do this? And a real sense in which primary care, that is going to your GP, is the way forward rather than going into an A&E situation from a construction site. So some real changes in terms of the way in which we communicate during the pandemic right across the industry, and also, of course, across the healthcare system. Much more digital engagement, more phone calling, more video conferencing with your GP, electronic prescribing taking place, much more use of apps and technologies that allow for early booking appointments, e-consultations, text communication, all that sort of stuff. And really what the construction industry needs is much better information about how you bring all of those technologies together to help construction workers. The NHS has done quite a lot of work in terms of how to address underserved, what they call underserved groups, and construction workers appear to be in this particular space. So construction workers need more support, more understanding of the technology, better to be encouraged, more monitoring and adapting some of that technology to their specific needs. So Richard mentioned Project Open Door. This is our next major campaign at the moment. This is about how do we create much better awareness and access to the primary healthcare system, that is to GPs. How do we create a culture within construction that enables health advice to be positively encouraged and brought forward? And how do we encourage the healthcare system and industry generally to allow and enable that to happen? So some of the key messages that we want to leave with you, get registered. So if you're in construction, get registered, make sure that there are pathways to getting that advice. Don't just register, but also react to get proper communications, proper exchanges, and get help with the new technologies that are available. The pilot is just about to start. We're looking at building on the King's Cross experience. We're hoping to build up some kind of local momentum around this. Better information to contractors right on the ground, better information to GPs about what they can be doing for construction workers. And then we're hoping with that pilot to roll that out into the construction sector generally. And we're developing or looking at how we can develop apps that can do that. So I'm going to hand back to Richard, who's going to wrap up.
Thanks very much, Andy. So, how to get involved? Key issues, really. Help us generate data. We need information. We need people to help us build a better knowledge base of the opportunities for intervention so that we can target our initiatives. Get engaged. We've got a number of campaigns that we'll be launching and are currently running. So sign up to our email alerts, sign up to our communications, and we can keep you in touch with those. They're all free to download. Ensuring that we get information out into our industry is absolutely critical to everything we want to do. And help us build a network, become part of our summit project in actually identifying key players that can drive change and help people in our industry. And ultimately, that's all that we're trying to do. We're trying to improve outcomes and health and well-being amongst our workforce and helping support them through very difficult times if they're unlucky enough to have to deal with cancer in their lives. We believe that the culture change of ensuring the industry encourages people to engage with healthcare and a positive attitude towards people taking time to look after themselves is the first and biggest gain that we can make. So I hope that you will get involved by linking on to our letters and subscribing to further information or getting in touch directly if anyone wants to partner up or get more proactively engaged in any of our campaigns. All that remains now is to say thank you very much to Construction Week for hosting us, and we'll happily take any questions.
Andy and Richard, thank you. My background, builder by trade, but now do a lot of broadcasting and media work, work closely with the Lighthouse, which is obviously another charity you're well aware of. I've got a few questions I'd love to ask if you don't mind. I'm self-employed and have been for quite a long time. I'm sure you're aware, but big site work, the big pressures to get done as quick as possible. Go, 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 go. There isn't the culture at the moment. Listen, I'm really suffering with, an enlarged mole, or my back is killing me, or my mental health's bad. How do you think we can go about changing that? Because the pressure we're on, each job, and I hate to say it, the reality is, if you're not pulling your weight, we'll get someone else in.
Yeah, so we've got a perfect storm brewing, haven't we? We've got material shortages, we've got people shortages, we've got shortages of people with skills. The industry is going to have to change. Things are not going to stay the same. But looking after our people is the only way we're going to attract more people into the sector and retain the people we've got. I think it's very evident. So there's a really important business case for the sector as a whole. The difficulty is that it's very fragmented, so people think it's always someone else's responsibility, and we think that we need much better leadership and much more cohesive messaging, offering up the support to small businesses and small business leaders to know how to manage through these problems better. So there's lots of good practice out there, it just doesn't happen in our sector. We all know about the site pressures, we all know about how stressful and intensive this industry is. But I also found when I was working as a site architect and working in the industry more directly, that there was a lot of there's a lot of collegiate behaviour. People do care about the people they work with. They do want to look after each other. How do we balance these two things out? That's what we really need to learn. But the culture has got to change. We will simply not retain the people we've got unless they feel that they are genuinely looked after. And they're people at the end of the day. They're people, and we should and could do better.
So let me just grab you the other microphone quickly, save you guys jumping around.
Can you hear me?
Is that one on there? Can you hear that, Hanno? Is it? Yes, that's it. It's on now.
Okay, your question was about how do small businesses deal with it when there's so much pressure at time. I think at the end of the day, you're talking about culture change right through the industry. So that goes right from clients commissioning through to contractors tendering, through to how that then feeds down into the supply chain generally. And our work is not just about addressing people who are doing the work on the ground, but also trying to systemically change some of the thinking. And we've just gone through this major health scare for the whole of society. And I think it's uppermost in people's minds about their health and their well-being. So people need to demand it, and leaders need to deliver it.
There's another question. Have a wry smile when I see you obviously work with government. I've been sort of lobbying them through various organisations I work with, trying to get change. And what you guys are doing with your charity, what other charities such as the Lighthouse and Mind and all the other is great. Should we not have more assistance from government? It's been talked about for years. I'm 45, I've not seen any change.
So government sets a meta framework, and I think help from government to make sure that's aligned with the right outcomes is always going to be important. This is an important part of the economy. The pieces in policy need to support it being a successful part of the economy. But I think most of the gains that are available are about us working more effectively as an industry in the first instance. So the barriers to people accessing healthcare are about being worried about people finding out they've got a problem and how that might impact on their work. That's entirely within the gift of the industry to change that attitude. It's about availability of access to healthcare and advice and services, and what we're trying to do through the site surgeries and Project Open Door is reflect the fact that COVID has driven a complete sea change in the accessibility of those primary healthcare services in terms of e-consult or remote consultations. They're now completely normalised and they're available through every GP's practice. So the time barriers and the availability barrier and the privacy barrier, if you can get in a corner for 5 minutes with a phone, you can get a GP consultation and start to get yourself into the system to actually get those health issues looked at. What was very interesting from the site surgery was that there were two options that people had. They could either go to the local surgery, which was less than a 10-minute walk from the site, or they could go into a temporary surgery set up on the actual development site itself, 100% chose the second option. None of them attended the surgery directly, as far as I'm aware. And that shows two things. One, there is an appetite amongst the workforce to actually get access to this and to ask the questions to get their health checked. Secondly, it's got to be convenient. Those barriers have got to be removed. And we think that opportunity is there now. But I know your question was about government, but, so I'll pass back to Andy.
Yeah, I don't mind saying yes, they should do more. I think we've obviously had a real focus on addressing the pandemic. There are much bigger issues out there that need to be addressed, are systemic issues like mental health, a sense of construction workers being exposed to real hazards that need to be sort of addressed. I mean, the one thing I do feel very strongly about that is a good thing government are doing are pushing innovation in construction and pushing ways in which you can build better, easier, undercover in safer conditions. So I think we need that sort of the systemic thing I'm talking about to also impact on the way in which we construct our buildings and the way in which we go about employing smaller businesses to do that.
I think that's... Sorry, Hannah, have we got a little bit... This is quite an interesting... back to sort of mental health. I've been very open on the journey I went through. I got complex PTSD, and through a very difficult time a few years ago with an absolutely horrendous 5-year divorce where I got literally homeless, nothing to eat. 3.5 years ago, woke up in hospital having tried to take my own life. And the sad thing with that was there was no help. And when I pretty much said, no family, just luckily good mates around me, I said, well, what am I going to do now? We're not really sure. And they said the only reason I was seen, and anyone would be seen, is if you're a threat to your own life or someone else's life. Now, my worry with that, with all the mental health statistics, 2 a day, suicides in construction more than anyone else, and 93% of us are under 7 employees, which is my firm, we haven't got the time, the money or the resource to deal with this. And I walked into one of my jobs, it's a residential double-storey extension and refurb a few years ago, a couple of lads chatting away, and I just caught a load of materials off the van, pulled it in, and I walked past a young bricky 28-year-old telling one of the other lads he was ending it that night. Now, I didn't know if I'd actually heard right, so I just dropped everything I had in my hands, said, Barry, let's go and pop out into the garden, we'll have a cup of tea, and he smokes, so we'll have a fag. And to him, his world had ended because he got caught speeding for the last time, so he lost his licence, couldn't get to work, more pressure financially, etc. And his missus caught him playing away, so he couldn't see his kids. Now, don't get me wrong, that's horrendous, but he's what I call this typical self-employed, because my lads are all subbies, self-employed youngster, had nowhere to turn. How do we get that message to them, which is predominantly the highest part of the industry, those young men and women that are living day by day with not a lot of access to help?
So the Summit project we've talked about is, in our view, the first step in doing that. We've got to map out who's working in this sector and then actually bring the different strands of activity to support mental health, physical health, well-being, support services, bring those together into an effective communication strategy that really targets particularly those smaller businesses and provides them with either tools that they can directly apply, so practical ways for them to look after their people better, or just helping them to find very easily routes to refer people through to the other services that exist. There's a lot of stuff out there. It's not always easy to find.
That was my question. And how do we get through to these one-man bands, four-man bands?
So I think we bring that is part of the journey that we're on to try and address that.
Yeah, I mean, just to build on what Richard just said, I mean, the Sun Safe campaign went to Dewsons, little certificates, little things that they could pick up on a counter on their normal supply chain, their everyday work. Giving information at that level is really what you need to be thinking of, as well as the leadership and the governments. So it's about easy access to information, as Richard said.
Just one final, I was on 5 Live yesterday morning talking about mental health in construction, And there was sadly a couple of horrendous stories of people that came on and lost a brother-in-law, etc., and a son. Kind of typical BBC. You're not really there for what you think you're going to talk about, which was my journey. I was right. If you were in charge, what would you do? Live, obviously I haven't got time to think about it. It's something I've always thought about, and I've been very keen to ask people like yourself. We cannot get through to people in our industry, especially individuals or 4 or 5 men and women teams, for many reasons. One big issue, we're not licensed. So anybody in this room can be a bricklayer, plasterer, chippy tomorrow morning, and no one's going to bat an eyelid over it. We need to be licensed, and it's great with youngsters coming through apprenticeships for that. I have no qualifications. I didn't do college or an apprenticeship. I just learnt off the old boys who are unbelievable. So I think that's saying, my view, I just want to finally hear your thoughts on this. If we had a panel, 10, 12 individuals, like yourself, 40-year-old bricklayer, architect, structural engineer, carpenter and joiner, put us all together, government-backed, and every company, if I'm a one-man band decorator, I'm multi-billion turnover as a developer, we pay a very small percentage as a levy to fund this, then me as a decorator or a chippy or the 5 guys that work for me can get in touch with this government-backed organisation, because I'm sorry, but speaking out, FMB, etc., they're a marketing agency. Can we get that far? Because I think young Dave, who's a plasterer that's struggling with his mental health, knows we've got a government-backed panel with a brickie on it, with an architect on it. We go there, he's only paying 1 or 2% of his profit, not turnover. I think that's a no-brainer, or am I just living it a bit in the clouds?
Look, I think things like that are absolutely what we should be doing. And I think it's everyone...
Can we?
Yeah, I think we can, actually. What I genuinely believe is that if we can bring the right people into the room, then people will simply buy into this because it is so sensible, and it's actually, it's wrong not to be doing it. And everyone benefits. Everyone will benefit. I used to, as a project architect going on site, I saw the stress and pressure that the supply chain was under, and when I went through my own cancer journey with my dad, I looked around and I just thought, how is everyone else coping? I had a supportive employee, I had a stable family situation, supportive employer, and I just looked at so many people in the supply chain and I thought, you all deserve better. So we should do it, and we can do it. I really do believe that.
Can we work with you to set that up?
It's my 2 big things, mental health because of my own journey, losing friends, horrible times of COVID, having to bury them online with a really crappy internet connection, and apprenticeships, which is another story for another day. But one thing I've found, and I joked with Hannah earlier, I'm a bit odd because I'm a tradesman that has got my own teeth and can speak at events like this. And I'm dealing with men and women on the ground day in, day out, their own personal battles, the material price rises, let's not go into that, a big boat getting stuck in the Suez Canal and everything. So many people want help, and that will change the perception of the industry, like in Germany, where me as a tradesperson is looked at the same level as a solicitor and accountant, whereas here it's, you get a bit dirty for a living and dig a hole. If we change that perception, the 1.7 million tradespeople will suddenly just go mad through the roof. And, I've gone from labouring in Sydney at the age of 18, working through this, sitting on bodies and boards, to doing this broadcasting and presenting work. There's so many opportunities. And I think we've got the best industry, but we're not presenting it in the right way to attract people in. And that panel, I think if we can get that sorted, bang, we'll explode.
Well, we'd be delighted to work with you on that.
Brilliant. I could sit here and talk all day, but Hannah's given me the eyeball. There we got another one. Thank you very much.